So this presentation is for Orange County Schools, and I am Kristen Prelip. At Orange County Schools, I have kids there, so there I go by Kristen Prelip Oguntoyinbo, but my last name's too long for normal people to deal with, so I cut it off for work. But yeah, my name is Kristen Prelip, and I'm the Public Information Officer and Communications Manager for the Orange County Health Department. And I just want to say that this presentation, I do lots of them, but this one is very special to me because, as I said, I've got kids in Orange County Schools. My husband and I are like Brady Bunch, but with 5 kids, and all 5 of them have gone through Orange County Schools. We've had Grady Brown, best school in America, A.L. Stambach, and now our 2 youngest are at Cedar Ridge. The older 3 have already flown the coop. They're off at college, but we love living here and think it's a wonderful place to live and work. Right. Okay, so today I'm just going to give a brief overview of our current situation with regards to COVID-19. I'll discuss the 3 COVID-19 vaccines. I'll answer frequently asked questions about the vaccines and COVID-19, and finally we'll review where to get vaccinated here in Orange County. I plan to speak about 15 minutes and then would like to save the bulk of our time for hearing from you all, the staff of Orange County Schools. Choosing to get vaccinated for COVID-19 is a really important choice, and it's a personal medical decision. So I'm very interested to hear your thoughts on it, and I hope you're able to feel comfortable sharing those. If not, I've got some places where you can call, where you can speak with somebody in a more private matter about any concerns you might have. We are realizing more and more that we're moving out of a pandemic into an endemic, which means that we now live with COVID-19, just like we live with the flu. Doctors and scientists are working to estimate the mortality rate of COVID-19, but at present, it's thought to be substantially higher, possibly 10 times or more than most strains of the flu. To give you an example, in North Carolina last year, we lost 203 people to the flu. In the 17 months since the pandemic began, we have lost more than 15,000 North Carolinians to COVID-19. As a community, we're all going to have to decide if that is a number that we are able to live with. We do know that vaccination works, and that is what I'm here to talk about. Just a quick note about this graphic on this slide. I made this as a large banner for these end of pandemic ceremonies that we are holding at the end of June. Obviously, the pandemic was not over on June 30th. But the Emergency Operations Center was closed on June 30th after being open for a record 523 days. Previously, the longest Emergency Operations Center activation was for 2 weeks from Hurricane Fran. So needless to say, many people and organizations were at high alert, working 7 days a week for a very long time. And I know that Orange County school nurses are now in that same position. And I just want to give thanks to them and let them know that they're invaluable. And I'm sorry that they're having to work so hard right now. So just a big shout out and a thank you to the nurses. Just to review, so we're all on the same page. COVID-19 is the infection that is caused by the virus that is known as SARS-CoV-2, which is a coronavirus. The common cold is also a coronavirus. Because coronaviruses have been around for so long, scientists had a huge start on the COVID-19 vaccines because they were already working on trials to fight other coronavirus infections before COVID-19 came along. Most people with COVID-19, thankfully, have mild symptoms, but some people, as you know, can become severely ill and may even die. Although most people with COVID-19 get better within weeks of the illness, 30% of people experience post-COVID, also called long COVID. These long haulers experience health problems for more than 4 weeks after first being infected. Older people and those with certain underlying medical conditions are more likely to get severely ill from COVID-19. But according to the Orange County Medical Director, Dr. Erica Pettigrew, who also works here at the UNC hospitals, they are seeing young, healthy people that need ventilators right now at the hospitals. That is very scary to hear, as being put on a ventilator is super stressful, and many people are not able to come off of it and recover. This graphic, I should note, is missing one symptom, sore throat. That is an official symptom. And the difficult thing about COVID-19 is that some people don't experience any symptoms at all. They still spread the virus though. That's why testing is so very important. Just to give you an example of this, I personally was tested for COVID-19 last November. One of my staff was going to do a PSA with me. We thought we'd each get tested and take a little video and just show how easy it was to get tested. We tested on a Tuesday morning. We got our results back on a Thursday, and hers was negative and mine was positive. I was super surprised. I had no idea that I had COVID-19. I'd been very, very careful, but I didn't start feeling poorly until the next day. And I was just so grateful that I happened to know and that I was able to kind of get all my ducks in a row and think about, okay, who was I around and who do I need to call? So testing is super, super important. So last week, North Carolina unfortunately surpassed 15,000 COVID deaths. Now, which is unusual compared to the beginning of the pandemic, nearly 1/3 of the new cases are children under the age of 17. Just so you know, here in Orange County, we are leading the state in vaccinations with 79% of community members fully vaccinated. But this virus does not care about county lines, state lines, or international lines. It will go wherever it can find somebody to infect. So as you can see with this current map of North Carolina, we have high transmission in the whole state. Orange County is right there. We used to be a lighter color. I check this every single week, and it was always such a good thing to see that at least we were doing a little bit better, but the whole state has high transmission right now. So what that means is it's safe to assume that there's wide community spread, and that as you move about in public, that people around you may well be infected and may be contagious. So please continue to wear a mask, wash your hands, and give each other space. Of course, the best option to protect yourself from hospitalization and death is to get vaccinated. I thought I would just give a quick example of how this works. And so basically, let's picture that I'm in my neighborhood and, we're all kind of doing more now. We're going to a few parties and getting out more. We're learning to live with COVID. There's this great map that Georgia Tech does where you can put in your county and it'll tell you if you're at a gathering of 25 people or 50 people based on our numbers, how many people there will be likely to be infected with COVID. And so right now, if I go to a gathering with 25 people, it's very likely that 3 people will be infected with COVID. And let's just pretend that myself and then my neighbor who lives in another home, Joe, is going to the party as well. Joe is unvaccinated, I'm vaccinated. What we're seeing with Delta variant is that it is possible that if I'm there and I really have a nice time at the party and I get up close and personal with people, that I could get a breakthrough infection, even though I'm vaccinated. Joe, it would be very easy for him to get COVID-19 because he's unvaccinated. And what will happen is that our trajectory will be very different. So what they're hearing with the Delta variant is that it's very good at multiplying. It multiplies a lot faster, which is why it's more contagious. And then it's also really good at attaching to your lungs. So for me, the vaccinated person, I will probably feel crummy and have a sore throat because it goes into my throat and it's multiplying. And then my body says, oh, wait, I recognize this. I know what this is. And it amounts a response. So my vaccine has told my body a recipe for how to fight this virus. So within a couple of days, I'll start to feel better. Whereas Joe, that same thing will happen, multiplying in his throat, and then it's going to go on to the rest of his body because his body doesn't know how to fight it. It doesn't know how to mount that response. So that's just a hypothetical thing, but we are seeing that play out quite often in the hospitals here. I'm sure you all have heard a little bit about what is long COVID. This is something we're learning a lot about this disease as we go along. Many people will catch COVID and then feel better within 4 weeks and really recover and feel like their old self. But some people are experiencing ongoing symptoms that last weeks or months. The strange thing about it is that it can be somebody who really was almost asymptomatic or had a very mild case can suffer from long COVID. So there are a whole list of things that you can feel when you have long COVID that's listed here. So just when we look at the schools, at your school right now, masks are being worn indoors. And then of the 12 to 17 age bracket right now at your schools that are eligible, only 35% of those kids are actually vaccinated is what we're seeing. So we are seeing many young people experience mild symptoms if they could get COVID. Unfortunately, it still holds true that a certain percentage will be long haulers. More than 5 million children and teens have tested positive for COVID-19 in the US since the start of the pandemic, while about 30% of adult survivors report long-term symptoms. Anywhere from 2 to 10% of young COVID-19 survivors are estimated to experience lingering symptoms. Some are just 9 years old. So researchers are scrambling to find effective treatments and more accurately determine how widespread this condition is. So to me, I just mentioned this because it really points out to me that getting vaccinated is a great act of love. It shows how deeply you care about the health of the people around you, the children that we're working with, and as well as your own health. So I really want all of us to keep in mind that it'd be nice if these students didn't have to suffer with long-term health complications for something that could be prevented. All right, and so then this graph just shows, I'm sure you've seen on social media a lot of graphs where the hospitals are saying these are the people that are in the ICU right now, unvaccinated and vaccinated. This is more of a national look at it. And what it's showing, CDC study shows that unvaccinated people are 11 times more likely to die of COVID. So with this graph, you can obviously see the yellow would be people that were admitted, that were vaccinated. So that would be somebody with a breakthrough infection, and then that blue line is people that are unvaccinated. So it feels like too many people are underestimating the cost of not getting vaccinated. We know that COVID-19 is an ugly disease. Obviously not everyone ends up in the ER or ICU, but when they do, it's devastating. Even mild cases of COVID-19 have a real risk for long-term complications and disability. And I mention this just because every patient who comes in with COVID-19 means one less bed for a patient brought in for a heart attack or a stroke or a car accident. Just to give you a local example, one of my good friends, she has 2 grown daughters who went through Orange County schools, went to Cedar Ridge, and her older daughter unfortunately had a breakthrough infection, and she recovered, and then she got E. coli, which is a really nasty intestinal bug. And so she was in the hospital for E. coli. She also has a heart condition, so she was really worn out. She couldn't keep anything down, and she was just barely making it. After 5 days in the hospital, they asked her to go ahead and go on home, even though she didn't feel ready and probably wasn't ready, because 3 people with COVID-19 were waiting for her hospital bed. So I would just like to think that if, God forbid, I drove home from work today and I was in a car crash and I needed a hospital bed, that there would be one there waiting for me. This is the same kind of point. This is from our Dr. Erica Pettigrew. This is a local look at our UNC hospitals. And what they're seeing is that 100% of COVID-related deaths have occurred in unvaccinated individuals. And I would like to point out that there are 66% of fully vaccinated admissions had immunocompromising conditions. So what they're seeing is the people that are having breakthrough, just like my friend's daughter, who she has these immunocompromising conditions where she has to be on long-term medication that makes it so that she doesn't have a strong enough immunity. So we're seeing older individuals and people maybe transplant, or they're fighting cancer, or they have some sort of other heavy medical stuff going on. Those are the people that are vaccinated that we're seeing in the hospital. But we'd say 100% of COVID-related deaths are unvaccinated people. We'd like to have no deaths. So now I'm well over halfway. I'm just going to go through some frequently asked questions, and then I'll just stop and listen to you all and see if you have any questions. I'd love to hear from you. So I'm sure you've heard about the Delta variant. What is the Delta variant? So this graph shows from the beginning, they name them in the Greek alphabet. So when I got COVID way back when, I probably had one of those beginning variants. So the Delta variant has been the most commonly circulating variant since the week ending June 26. Any virus will mutate. This is a normal thing. What they're seeing with the Delta variant is that it's more contagious. They say about twice as contagious as other variants. I've heard some people say it's about as contagious as the chickenpox, if you're old enough to remember what it was like to get the chickenpox. I do. Some data suggests that the Delta variant might cause more severe illness than previous variants in unvaccinated people. And unvaccinated people remain the greatest concern. Fully vaccinated people with Delta variant breakthrough infections can spread the virus to others. However, vaccinated people appear to spread the virus for a shorter time. All right. Another frequently asked question is just, what are these vaccines? So we know that there are 3 vaccines available right now in the US. We've got Pfizer, which has full FDA approval, then Moderna and J&J, which are both under emergency use authorization, also referred to as EUA, but we expect them to get full approval soon. Pfizer and Moderna are both the mRNA vaccines, and the Janssen or J&J is a viral vector. The first 2, you have 2 shots given several weeks apart. 2 weeks after your second shot, you've reached your full immunity. The Janssen is a really good option for people who are afraid of needles, which is a really common fear. It's nothing to be ashamed of. Lots of people have it. So if you want to get 1 shot and be done, the J&J is the one for you. I just want to note that people often feel really uncomfortable that these vaccines seem to have been developed really quickly. This is understandable to worry about, but in order to understand, it is helpful to ask this question: why does it take other vaccines so long to get to the point where they can be used? Some vaccines can take years to develop and be used, so people may worry that this particular situation did not take years. According to our medical director, Dr. Pettigrew, there are 2 main reasons that vaccines can take years to develop. You need 2 things to happen to have a successful vaccine trial. First, you need participants, and you need lots of them. For other vaccine recruitment, this is what takes so long, is asking people to participate in something that probably doesn't seem very relevant to them or very important. So they spend years recruiting. In the case of COVID-19 vaccines, there were tens of thousands of people who signed up easily. So what normally takes years of recruitment was very easy in this case. The second piece that usually takes a long time is that you have to see a statistical difference between the people who are taking the placebo, which is the fake vaccine, and those that are taking the real thing. If you don't have a lot of infection in the community, naturally, this will take many years to gather this data to be able to see the difference, to know whether the vaccines are working or not. Sadly, in the case of COVID-19, we had tons of COVID-19 in the community. So the scientists running the trial were able to collect this data quickly. The other factors that contributed was there had been years of previous research on related viruses, faster ways to manufacture vaccines, enormous funding that allowed firms to run multiple trials in parallel, and regulators moving more quickly than normal. Just thought I would go over the side effects of the vaccine. I know that's something that makes people hesitant. They think, well, gosh, I've heard that if you get the shot, that you feel pretty crummy for a couple days, and that it can be true. So here are some of the side effects. Just to give you a personal example, as I mentioned, we've got 5 kids, and it's myself and my husband. Our kids all had just a little bit of pain at the injection site. My husband had one night where he just didn't feel great. He kind of had chills, and then he'd get hot, and he just didn't sleep well, but then he felt great the next day. I had a couple days where I really felt pretty crummy. I don't know if that was because I've already had COVID-19 or not, but it just seems to be really a wide range. But I have to say, as a person who did have a couple days where I didn't feel great, it was worth it because knowing that I couldn't get COVID-19 anymore was a huge relief. So I would do it again. If we end up needing to do booster shots, I would happily take it. A frequently asked question we get is, should you be vaccinated if you've already had COVID-19? The answer is yes, absolutely. So when you get COVID-19, they're estimating that your immunity lasts about 3 or 4 months. So it would be important to get vaccinated even if you've already had it. And as you can see, these variants are coming fast. So the COVID that you originally had is different from the COVID that is circulating now. We hear a lot about concerns about vaccination, if it causes any problems with pregnancy or fertility. They have been studying this widely, and the answer is that there is no current evidence that vaccination causes any problems with pregnancy, including the development of the placenta. In addition, there's no evidence that fertility problems are a side effect of any vaccine, including COVID-19 vaccines. Unfortunately, a study just came out showing that only 23% of pregnant women are vaccinated. We'd really like to get that number up because pregnant women tend to have a harder time with COVID-19, and there's a lot of sad stories in the news. What we are seeing is that women who get or are vaccinated, they're able to pass on some of their immunity to their babies after they're born through breast milk. So that's a wonderful gift that they can give. We've heard people worry about if the shots can alter your DNA. No, COVID-19 mRNA vaccines do not change or interact with your DNA in any way. Both mRNA and viral vector COVID-19 vaccines deliver instructions to your cells, like a recipe, to start building protection against the virus that causes COVID-19. However, the material that never even enters the nucleus of the cell, which is where DNA is kept. All that material is eventually just passed out of your body. So that's 15 minutes. I would love to entertain any questions from people. You all have the difficult but very rewarding task of working with little kids. So we know that the kids that are younger than 12 are not eligible to get vaccinated yet. They're hoping that they have the Pfizer ready by the end of the year, and then the J&J and Moderna are right behind them. But you know, these trials, they cannot skip a step. They can't rush it. So it's just, it is what it is. So we know that these kids under age of 12 will not be vaccinated until later this year. So if we just want to remind people, just using those same things that we've learned how to use, they really work. The masks work. Outdoors is always better. Gathering small is always better. Airflow is always better. Basically, if the virus can't get into your nose or your mouth, then you can't get sick with it. You might have heard a lot about, people are talking about this additional dose and the booster. So they're two very different things. Boosters have not happened yet. They're still talking about it. When it does happen, we will shout it from the rooftops and let you know about it. But right now, additional doses are available for people who you mentioned being immunocompromised. Some people who got those 2 shots, they're realizing that they need an additional shot. This is a tiny fraction of our population. It is 2 to 3% of people. These would be somebody who's actively fighting cancer, maybe had an organ transplant, is fighting HIV, maybe is on a long dose of steroids for some sort of something. So basically immunosuppressive drugs. And they're just realizing they will be better served if they have a 3rd or an additional shot. So that's the deal with that. And then we have a wonderful mobile vaccination team. When you were talking about being afraid of shots, we have our mobile vaccine team go to people's houses, because sometimes that is the thing. Like if you can just be in your own area and not have to leave and feel like, okay, if I freak out, I'm at least just at home with my cat, you know? So you can call them, you can fill out this form online and they'll schedule to come to your house. They're really lovely people and they will do a great job, and they'll come back for that 2nd shot too. We mentioned the 2nd dose. If people did not get their 2nd dose, no worries. You can just come on over to any of our walk-in clinics and get it. This was talking about if you're undecided, you can call our phone number. It's 919-245-6111. You'll leave a message and then somebody will call you back. So one of our nurses will call you back. And they are really patient and really wonderful, and they are a wealth of information. Sometimes I call them with questions, and it's just nice to be able to talk to somebody who's a professional. These are our walk-in clinics. I'm over here in Hillsborough today at our Whitted Human Services Center, Monday through Saturday, 9 a.m. to 5 p.m. There are people right downstairs. I guess they just finished for the day, but anyways, you can walk in or you can make an appointment. And then over in our Chapel Hill location, it's Monday through Friday, 8:30 to 4:30, same thing. You can walk in or you can give a call. But they're lovely people and they'd be glad to help, and they're not very busy, so you'll probably be one of the only ones there. We also are doing pop-up clinics all over the county if transportation's an issue, if it just feels better to have something right close by to you. We've got last Fridays, we're going to be at the old courthouse, so you can always check our website for that. It's orangecountync.gov/get-your-shot. And testing has been really popular. I'm at the Whitted and I think there was a line last time I looked out. So there's a lot of people getting tested. That's really powerful to know what your situation is, so you know what to do. So Chapel Hill, we've got Monday through Friday, 7 a.m. to 3 p.m. And here in Hillsborough, Monday through Friday, 11 a.m. to 7 p.m. It'd be nice if you registered, if you had time, just because it'll go a little bit faster. But if you cannot register for whatever reason, they'll just do it on site. And then I just lastly wanted to remind everybody that because of this high community transmission, Orange County commissioners decided to institute a mandate to have masks indoors. I know everybody was ready to throw away those masks. I get it. But this is just something that really does flatten that curve. We just don't want to get to the position where our hospitals are having to ration care. I also know that the medical professionals who serve us and take care of us are exhausted. So it'd be a kind, loving thing if we can all just do whatever we can to flatten the curve so we can get through this. And then here are, I mentioned there's another phone number that the state runs where you can call and ask any question that you want. If you're just kind of on the fence about the vaccine or just have any questions at all, that's here. I'll be sharing this whole presentation out tomorrow. And I'll also have my email on the end of it. So you can always call me. You can always email me if you have any questions about anything.